This Focus on Health segment is brought to you by Aurora Healthcare.
Hi everyone, welcome back to Oshkosh Today. I'm Connie Carmical. There's a unique partnership here at Aurora Health Center in Oshkosh. It's a joint practice between a physician and a nurse practitioner. The relationship doesn't replace the patient-caregiver relationship that is the hallmark of medicine here at Aurora, but it can enhance the power of healing. On today's Focus on Health segment, we meet up with Dr. John Carlson and nurse practitioner Julie Marx. Thanks so much for joining us. Now, could you both tell us a little bit about yourself?
I joined Aurora in 1981. Since that time, I have held a variety of nursing and supervisory roles. I started with Dr. Carlson in 2000 as his primary nurse. I continued that role while I went to graduate school. After my graduation, Dr. Carlson then asked me to be a nurse practitioner in his practice.
And how about you, Dr. Carlson?
Yeah, from Milwaukee and medical school in Milwaukee and residency in Milwaukee at St. Luke's Hospital on the south side of Milwaukee. Joined Oshkosh in 2000 as my first job out of residency. And been doing a multifaceted family practice since then.
So, Dr. Carlson, could you describe the model of the collaborative practice here at Aurora?
There are many different definitions of collaborative practice. The one that we are using in the family practice role is more based on one physician with one nurse practitioner. Again, there are other forms of collaborative practice. What we have evolved and what we do here is a team effort. It is a combined practice between Julie and myself that we run together, and I really think it offers a lot of benefits for the patients as well as ourselves. But the most important thing is that the patients, I think, get a much better service.
So, Julie, could you tell us a little bit about the educational preparation?
Certainly. A nurse practitioner is an experienced registered nurse who has graduate level training as well as demonstrated clinical competencies in order to provide health care in the acute setting, long-term settings, as well as the primary care settings. All nurse practitioners today have master's degrees in nursing. Most nurse practitioners, including myself, are board certified and hold prescriptive authority.
Okay. And describe what nurse practitioners do.
Sure. Nurse practitioners obtain health histories, do physical examinations, diagnose and treat acute and chronic illnesses, request and interpret lab studies as well as x-rays. We prescribe and manage medications for acute and chronic illness. We are also very instrumental in healthcare teaching as well as supportive patient counseling. Our emphasis is always on disease prevention and health maintenance.
Dr. Carlson, could you tell us how this benefits your patients?
Our version of collaborative practice, where it really is a team model, where we have one large practice that we both manage, I think offers a multitude of benefits for the patients. First of all, I think it really offers multiple options as far as, do you want to see a male provider, do you want to see a female provider? Julie has skills in education for patients that I don't have, and I have skills in taking care of patients that Julie doesn't have. We are really the best of both worlds. I think it offers, beyond choice, also a wider range of visit times. The reality is I can't be here 24/7. Julie can't be here 24/7, but we separate our days. When I'm here for a long day, Julie will be here for a shorter day. When Julie's here for a longer day, that'll be my shorter day. So I really think it allows us to meet the needs of the patients and what we call time-starved family. Who of us doesn't wish we had more time in a day? And the reality is sometimes you can't see someone between 9 and 5. We need 8 o'clock in the morning. We need 6 o'clock at night. And so some days I'll be able to provide that. Some days Julie will be able to provide that. But someone should be here Monday through Friday who will, over time, get to know you and your health care. And I really think that is probably the biggest benefit, is that access for a time-starved world that we live in. There also is this idea of the teamwork. If I'm uncertain about something, I'll ask Julie. If Julie's uncertain, she'll ask me. And so it really has been well received by patients. Lots of choices, lots of options. It's a benefit for the time-starved family, and I think going forward, it's just going to continue to grow and grow in our options. I just think it's going to be a wonderful thing for the patients to have a team working for them rather than just an individual physician.
Well, it's great that here at Aurora you have more than one person looking after a patient. Is there anything else you'd like to add?
I think personally, too, it's just a lot of fun. I mean, I enjoy working with Julie, and I think she enjoys working with me, and I think that comes through, too. The responsibilities don't necessarily all fall on one person. So on a personal side, I just find it more fun working in a team environment than in an individual. And so I guess there is some selfish things, too. I'm just really having lots of fun in my job, so.
Our shared responsibility and accountability for our patients can only mean better care for them.
I agree. Yeah.
Well, thanks so much for joining us.
Yep, thank you.
Thank you.
As you now know, medicine isn't always conventional, and it takes new and different approaches to find better ways to help patients. If you have any questions about being a nurse practitioner or the partnership between Dr. Carlson and Julie Marx, please call the Aurora Health Center in Oshkosh at 303-8700, or you can always log on to the web at www.aurorahealthcare.org. I'm Connie Carmical, and thanks for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.